Innovative technology is changing the way your furry friend can receive the treatment they need. The new I-Loc system introduces a way to stabilize fractures so your four-legged family member can have a quick and painless recovery. On this episode of the Paw Report, we talk to Dr. Danielle Marturello from the University of Illinois College of Veterinary Medicine.
Finding a solution for your pet's behavior problem can be confusing. Dr. Sally J. Foote helps you help your pet. Private consultation and resources are available at drsallyjfoote.com. Foote and Friends, better bond, better behavior.
Fetcher's Pet Supply on the north side of the Charleston Square, serving the EIU community since 1991. Fetcher's welcomes all pets on a leash, is open 7 days a week, and offers made in the USA food. Pet supplies for dogs, cats, reptiles, and fish. Fetcher's Pet Supply in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
And welcome back, and thank you for joining us for this edition of the Paw Report. As you see, we have taken all of our equipment on the road today to the University of Illinois, and we are joined today by Dr. Danielle Marturello. So thank you so much for joining us today. We're talking about a very unique and potentially new system of some surgical techniques that we're going to talk about today. But first time on the Paw Report, so yes. Thank you for joining us. Tell us about you and your background.
Yes, well, I did my veterinary degree here at the University of Illinois, and then I did a couple of rotating internships and surgical internship around the country, ended up landing in Michigan for a research associateship for a year, where I stayed on then for residency, did a dual master's program, and then accepted my position here as faculty at the U of I.
Excellent. And you have a friend.
Yes.
You have to introduce Hank to our viewers.
This is Hank. So Hank belongs to one of my orthopedic nurses, and he's decided to wear his tie for us today.
Excellent. He's very intently looking at the treat that's way over yonder that he's going to get. So thanks for joining us today, Hank. Well, we're going to talk about fracture repair on this episode, and specifically a technique that you use in surgery called the I-Loc System. Let's begin about talking about the various ways animals can experience a fracture. I know that may sound simplistic, but there are, from your experience, different things that can happen to animals.
Yeah, so I would say the most common is a trauma from a road traffic accident. So they escape from a yard, run out, get hit by a car. I've unfortunately seen sometimes that owners have actually backed over the animals if they don't realize they're behind the car. So sometimes we get rollover injuries. I've seen animals jump out of windows and actually break things because the windows have been too far down and they've leapt out of the car while it's moving. And in some cases, unfortunately, we do see cases of abuse, but those aren't that common. I would say mostly just road traffic accident.
Do you ever deal with fractures that are just maintenance fractures? You know, they're running, they're playing, they're bullying, you know, with other dogs, and that can happen?
Yeah, on occasion, if they're very young, sometimes they're a little bit easier to break in that instance where they're not doing kind of too much that you'd consider a fracture. I've seen some where they've been out in the yard and maybe gotten twisted around their leash and actually broken a bone that way. If there doesn't tend to be a lot of trauma, unfortunately, we often associate those with more of a pathologic fracture that could be secondary to like a bone cancer. If they're just, say, walking down the driveway and slip and fall, that doesn't usually result in a fracture.
So you have a client that comes in. What is the process for deciding what will be the best plan of action for that for that animal that comes in?
Yeah, so most of the times we get referrals from veterinarians that are around us, and so we have some kind of idea of what the fracture looks like because they've taken a set of x-rays. But we always repeat x-rays here, and the reason is that I want to put a measurement marker right next to the bone so that way I can decide on what size of implant, and I really have a good idea of how much space I have in some fractures. And so they'll come in either through the ER, or sometimes the veterinarians will just call us directly, and we'll get the patient in, we'll admit them. If it's a lower limb bone, say a forearm or a lower leg bone, they'll often be in a cast or something to help stabilize that for transport. So we'll take them down to radiology, get some images, and then based on the fracture pattern, where the location is, if there's any little fissures extending out of the fracture towards a joint or something, I take all of that into consideration. Also, what bone, the age of the animal. I also take into consideration how active is that animal. If it's a very young dog that's going to be hard to keep quiet at home, I have to consider that my implant is going to need to sustain a little bit more activity than maybe I would like it to, because owners just do the best that they can. And unfortunately, the dogs or the cats don't understand that we need them to be quiet in order to heal. And so I take all of that into account.
So today specifically, we're going to talk about the I-Loc system. We're going to get to that in just a moment, but there are many options for bone fracture repair that you've experienced over the years. Mm-hmm. What are some of those?
Yeah, so probably one of the ones that would be very easy to put on if it's not a very displaced fracture, if it's a very young animal that is expected to heal quickly, sometimes you can just put a cast or a really robust bandage on it and stabilize that. As far as implants go, something that this is a bit of an extreme version, but this would be kind of an external fixator option. So typically what we see with this is just the bar and the pins that are going into the bone. And so the pins right here and the bar actually are outside of the skin, and so owners will have to care for pin tracks and stuff until that's healed. So we don't use this a ton. There's some instances in which that will be most useful. And then one of the more common ones that we have are plates, and so this is just an example of a plate that we have. This is just a small plate. They come in different varieties, and this is something that goes on the surface of the bone, so not in the center of it, but just on the surface. It's all under the skin. We close everything on top of it, but I would say that a plate is one of the more common things and what a lot of people will feel comfortable with. One of the first implants that we had to repair fractures. And then you can combine plates with things. So if you needed a little extra stability, you can place a large pin down the center of a bone, and then you just have to kind of aim your screws around it, but that can be used to add mechanical stability.
Now, the system that you specifically brought to the University of Illinois, the College of Veterinary Medicine, is the I-Loc system. How does it compare to the other options that you just talked about? Or first, maybe you could just define what it is and how you learned about it.
Yeah, so the I-Loc is a form of fixation called an interlocking nail. And so what that means is there's various kinds. The I-Loc isn't the only interlocking nail, but it's one of the newer ones, and it's what we call an angle stable device. And so what that means is it's kind of like an internal fixator, and so it's very stable in rotation and also in bending. And so those are the two main things that will act on a bone when an animal is walking. And so that's what I have to combat as a surgeon and make sure that those forces don't overtake the implant stability, or else the fracture repair will fail. And so the I-Loc I've brought here is a large rod, and what you can see is that it's kind of an hourglass shape. And so it's wider at the top and at the bottom. And so that means that in the center here, where it's a little bit more narrow, I don't disrupt the blood supply in the same way, but I have contact with the edges of the bone, top and bottom, and so that gives it some stability. And then you can see here I have a bullet nose kind of tip. It's not sharp, so I don't worry about violating the joint space when I'm placing this. And it does go down the center of a bone, and so if I were using this bone, which is one of the ones that I've 3D printed here, so it kind of goes down and sits in the center, so you don't actually see it here. And then these holes have threaded cannulations in them, and so it's the bolt just kind of threads right in, and it locks in that way. And so once you place these, there's an alignment guide so that you can know where the holes are at because it's inside the bone, you don't see it. And that helps me to drill these holes, and then I cut each of these bolts to the length that I want that's specific to that animal. Go ahead and place those, and it just threads in like you would be, threading something in kind of like a broom handle, for instance. And so this is very stable because at the top and the bottom, there's a type of bone that's very sturdy. And so when these bolts are placed in that kind of bone, it's called cancellous bone, it's very stable. And so we don't worry as much about that failing. And I've not seen many of these nails fail, thankfully.
How did you learn about this system? I know you had a mentor at the previous, at the university you were at prior to the U of I.
Yeah, and so my mentor was Dr. Loic Desjardins, and he is at Michigan State, where I did my residency at. He's actually the inventor of the I-Loc system, and so he created this system. It's his design, his patent, and so I learned it from the man himself. I was very fortunate to do that, but also you can learn this system at various conferences and continuing education. So the company that makes this nail is called Biometrics, and they do offer continuing education courses. And so if someone were wanting to learn this system, we do training programs for them so they can learn how to use that system at those courses.
Does when you get a fracture, an animal that comes in with a fracture, do you really evaluate at what part of the area is fractured to determine if that's going to be the most beneficial way to repair?
Yeah.
Is it just in the extremities? Is it arms? Can it be anywhere in the body?
So it can be, I would say, in any long bone, pretty much. And so I absolutely do consider where it's at in the bone. And I would say a fair number of fractures are going to happen in the middle of the bone, so the shaft part, so this diaphysis, this part here. But very often we actually do see fractures. In a study that we had done with the smaller version of this in cats, we actually found that about 20% of fractures occur in the lower parts or the upper parts of the bone, called the epimetaphyses. And so that would be somewhere around this section here. And that makes it a bit more challenging because you don't have as much bone stock with which to put implants in. And so the I-Loc actually works very well, and we found was very stable. And so what you would worry about if you were placing, say, a bone plate is that maybe you only get 1 or 2 screws in there, if even that, and it really reduces the mechanical strength of the repair. And with the I-Loc, we can actually modify the end of it to make it have a little bit less metal at the end, so I can push it a little bit farther down into the bone to get those very low down fractures. And so we've used them for articular fractures, meaning it involves the joint surface itself. We've used them for these lower epimetaphyseal fractures and then diaphyseal fractures as well. And I would say just about any long bone. So you could do the tibia, which is what this is, which is the lower leg bone. You can do the thigh bone, which is the femur. You can do the upper arm bone, which is the humerus. The only one you can't really do is what's called the radius in the lower of the forelimb here. And that's because the bone is just very flat and kind of curvy. And so there's not really a good access point to place the nail. And so that would be the one case that I wouldn't be able to use that.
You did mention feline, so
Yeah.
So it can be used in canine, feline, and any other species?
Yeah, so the this size nail is made for dogs, but we did just recently have the smaller one become available, and that was what a lot of my master's research was focused on, was actually the mechanical validation of that to say, yes, it is safe to use in these cats and small dogs. And so we can use it in dogs, we can use it in cats. We even put a couple of them in some cows, so some very young, they weren't full-grown cows, they were calves. One of them was only 5 days old when we did it, but they both had an excellent outcome, and so you can use it in bovine too.
Does age play a part in this? If you get a rambunctious puppy that comes in versus somebody like Hank, who might be a little bit older, how does age play a part in this type of surgery?
So age is a consideration. The thing I would say about age is that they are expected to heal very quickly, and so an interlocking nail may be a bit kind of very too stable almost. It's not always needed. That being said, in the cat study that we did, the youngest animal that we placed an interlocking nail in was 6 weeks old. and that cat went on to grow normally, heal normally, and healed very quickly. So I would say it's not a consideration in the sense that I wouldn't place it. The thing that you have to be careful about is that in those young animals, they are still growing. And so their growth plates are open. And so you have to be very careful and very meticulous about where you place the implant so that you don't disrupt that growth pattern. So if I put it too far to one side, for instance, I have the potential to disrupt the growth pattern such that one side will grow more than the other side, and that might cause an angular deformity. Now, the nail size relative to that surface area of the growth plate ends up being pretty negligible, but certainly it is a consideration, and you have to be very careful when you do place it in a young animal like that.
So the device essentially will grow with the animal, or do you have to do a replacement surgery years down the line if you're dealing with a young animal?
Yeah, so it won't grow, so it stays the same size, but the animal will grow around it. And,
Right.
and that's the same thing with a plate. And so sometimes we put, a plate on that spans the length of the bone in a young animal, and when they come back, for something else, months even later, they've grown so much that now the plate looks kind of short or something. And then same thing with the nail. And so we don't really have to replace it, or, once that fracture's healed, they don't really need the implant any longer. And so we just leave it in unless it causes a problem. Now, the difficulty if you have an interlocking nail in an animal that's grown around it is that I can't capture the top flanges anymore. And so that is a way that I remove the nail. And so I always leave these flanges at the top sticking out. And so if the animal grows around it, that obviously negates the ability to recapture that flange.
Right. So can a variety of fracture types benefit from the interlocking system, the nail system? I know you mentioned it briefly in the beginning, but you see all types of different fractures and repairs.
Yeah.
So can a variety benefit?
Oh yeah. And so not only does the location, but even if it's a contaminated fracture, so if they've had a bone shard kind of poke through the skin and it's created something called an open fracture where that bone is open to the environment, I can still place the interlocking nail. I can still place a plate. It will still heal. I just have to have it to be very stable. And what I always warn owners about is that I might just need to take that implant out once the fracture is healed. And so if that's the case, it's a second surgery. The implant can be a source for infection to set up on in those cases where there's a large contamination. We obviously do our best in surgery to flush and really clean out that contamination. But it is something that it can happen even without it being an open contaminated fracture like that. So it's just something we always warn people about with internal fixation, is that we might have to remove the implant later on down the road.
We are as close as we can be to the surgical area where you actually perform these surgeries.
Yep.
Take us into the operating room. How long does a surgery like this typically take? Every client's going to be different. And take us through the recovery process, not just here at the hospital, but when a dog like Hank has to go home. I would believe that that's a huge responsibility for a pet owner, that they're going to have to commit to therapy with their dog.
Yeah, and so, kind of taking you through, so we prepare the animal out in the prep room and kind of get the leg all clipped so that there's no hair. We give them a nice surgical scrub so that we get them aseptically prepared. We usually, because I do orthopedics, we usually have kind of we hang the limb initially so we can drape it in sterilely. We have sterile table, everything like that. And so once that animal is all draped in, and we have a dedicated anesthesia person monitoring them for the whole time, they've got a specially designed anesthesia protocol just for them and their underlying conditions, their age, what have you. And so a typical procedure really depends on the difficulty of the fracture. So if it's a nice one that I can just put the pieces right back together, it's maybe a 2-part fracture, that's going to go a lot quicker than if I have a really comminuted fracture, meaning it's in several pieces, or if it's very close to the joint, I have to really make sure that I get that joint surface really reconstructed nicely so that there's no step, because that will minimize the chances for an animal getting arthritis later in life. And so it just kind of depends on the fracture itself. Some go as well as 30 minutes, some take several hours, and just depends on the difficulty. And then in terms of recovery with the interlocking nail, they're usually walking on it the day after surgery, actually, and putting a fair amount of weight on it. So I feel really comfortable with this implant, and I don't worry about it failing in the same way that I do worry about some of the other implants failing, because it is such a well-designed and solid implant. So usually they're walking on it. We usually have a little sling that goes under the belly that we help them to walk with. We send them that home with the owner just so you can, kind of catch them if they're going to have a little bit of a misstep and you don't want them to fall and land funny. So they usually go home with a sling, and we usually ask them to be activity restricted, so meaning they're confined to a cage or a very small room where they don't have furniture or a bed or something that they can jump on, for about 8 weeks. And that's the average. In a very young animal, they might be healed as quickly as 3 or 4 weeks. And in a little bit of an older animal, maybe it takes a little longer than 8 weeks, but 8 weeks is about the average. And we usually repeat x-rays somewhere around the 3 to 4 week mark, just to make sure we're headed in the right direction, healing's taking place as expected, and then usually a final set of x-rays at around the 8 week mark.
Any post-therapy, like water therapy or anything of that nature that you recommend for owners too, to kind of incorporate into their healing process?
Oh yes, while they're in the hospital here, they do undergo a rehabilitation kind of therapy with our dedicated rehabilitation nurses. And so we'll just usually consist of some gentle flexing and extending of those joints and kind of some massage. For 2 weeks until the incision is healed, we can't put them in a water treadmill or anything like that, because we worry about the incision getting wet, and that needs to heal first. But then after 2 weeks, we could certainly put them in the treadmill. I would say with the nail, they're using it so well that physical rehabilitation, it's super nice, and I think it will help them get back to kind of their full function a little bit quicker, and I always recommend it. But if somebody doesn't have the time to drive to us, because it's kind of a several days a week kind of thing most of the time, it really depends again on the case. But if they can't do it, usually just having them do some walking at home, so not too much, just 5 or 10 minutes outside to go to the bathroom, but because they're using that leg pretty well, they tend to have a very good outcome and not have any residual kind of restriction of motion or anything.
You've performed quite a few surgeries as the lead and also under your mentor. Any success stories that just pop out in your mind of a particular client that maybe just was, the trauma was really intense, and it was just a joy for you to be able to help this animal that maybe didn't have a lot of hope?
Yeah, well, the first one that comes to mind is Deuces, and he was the first one that I used the interlocking nail in when I came here. And so he had gotten out and gotten hit by a car, as they tend to do, and he had a femur fracture, so of the thigh bone. And he was one that we had, I don't know if you saw the news story that they'd put on the website, but that was our first one, Deuces, and he had a little black circle kind of around his little pit bull. And so he did very, very well. I was very happy for him, and he was very excited to come back. When he came back for his rechecks, he met all of his students and was giving lots of love to everybody. So he's a very sweet boy. And then this one actually is another fracture that I printed. This was a dog called Caitlyn. And you can see how high up on the bone, so this is also a lower leg bone, and it was in a lot of pieces, and it was very, very close to the joint. And so as you can see here, there's just not a lot of places to put an implant. And so that's why I think the interlocking nail was a very good implant for this particular fracture. And this dog also had a very excellent outcome. And this was a very challenging one. This was one that took several hours to complete, but it resulted in a very good outcome. What are you doing, Hank?
Hank's sniffing around. He's checking out the other implants down there.
He's checking them out.
He's sniffing for a treat.
But yeah, so that was another case that ended up very well, but I think it would have been very challenging to place any other kind of implant in that situation. So.
Any other animals that come to mind?
In my time here, or just in
general? Yeah.
Well, all of the cats in our study were quite funny because, trying to do a lameness exam
Herding
on a cat.
cats, that's what they say.
So those were always quite fun to see back, because you'd try and assess how they're walking, and trying to get a cat to do a lameness exam or not just stop and stare at you is always a bit of a challenge. So those were always very memorable. And like I said, the youngest one was about 6 weeks old when we did his fracture repair, and so that was a very cool case because it was a very young one. And actually one of our surgeons, this was during my residency, actually ended up adopting the cat because he was a stray, and so she ended up adopting him. And but I mean, they're all memorable. I remember every patient that I do surgery on, and There was one that I did here, very cool, in the lower leg bone. We'll often actually I'll bend the nail at the table just to match the natural curve of the bone. And so that was the first one that I had done here. My mentor's been doing that for a while. And it's okay, Hank.
Okay, Hank.
You're okay, buddy.
We're almost
He says,
done.
I want my treat. But that was also a very cool case. That dog happened to jump out of a window, but she's going to be featured in the biometrics calendar. So I submitted her case to biometrics. They put out a calendar every year of the different patients that they've gotten either hip implants or different kinds of things that they produce. And so they do a calendar, and so she's going to be in the calendar this year.
Oh my gosh. Well, what a great way to end the interview today. Such great stories and such great information. And we appreciate you and Hank taking a few minutes to join our viewers on the Paw Report. Dr. Danielle Marturello from the University of Illinois, a surgeon here, talking about the I-Loc system. Thank you so much for joining
You're
us.
so welcome.
And thank you for joining us for this episode of the Paw Report on the road. We'll see you next time back in the studio.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Fetcher's Pet Supply on the north side of the Charleston Square, serving the EIU community since 1991. Fetcher's welcomes all pets on a leash, is open 7 days a week, and offers made in the USA food. Pet supplies for dogs, cats, reptiles, and fish. Fetcher's Pet Supply in Charleston.
Finding a solution for your pet's behavior problem can be confusing. Dr. Sally J. Foote helps you help your pet. Private consultation and resources are available at drsallyjfoote.com. Foote and Friends, better bond, better behavior.